I think people are on quite a considerable and amazing emotional journey when they have a diagnosis of cancer and go through treatments and onwards after treatment. And there are different emotional experiences at different times as people go through that. And to gather support for themselves in dealing with some of that emotional impact is really such an important thing to do. And it may be that friends and family around are all that's needed, but for many people, talking to somebody like a counsellor or talking with other people in a group is another way of accessing emotional support, which they're maybe not getting in quite the same way from their local support network, if you like.
I was 39 when I was diagnosed, and initially I was actually told that it wasn't cancer. So I suppose it was mixed feelings really, because I remember breaking down in front of the consultant when he said, you know, Mrs. Haynes, you don't have cancer. I was there with my husband. You know, only to be told 3 days later I had cancer, that I had to have a mastectomy.
One of the things that, you know, listening to you is that almost rise and fall of you think it's going to be one thing, then it's another, and you're kind of getting used to one idea, and oh, there's something else you've got to get your mind around. And also that sense of propulsion into the treatment. It comes at you so quickly, you've hardly got time to adjust to that.
I didn't feel ill.
No.
I thought, how could I possibly have a life-threatening disease?
Absolutely.
And I look perfectly, and people were saying, oh, you look so well, without knowing what was wrong with me.
Yes.
And I couldn't really believe that it was true.
No. The way people respond to diagnosis can be very different, and one of the things I want to say about that is that whatever the person's way is of responding, that's the right way for them, and not to feel that they're not doing it the right way, because sometimes other people feel they ought to be doing it kind of differently.
I mean, I was a trained nurse, and I spent a lot of my professional life actually nursing cancer patients. But whether it's a good thing to be professional and know or not know, it's a two-edged sword. When you go for your results after being told that there's a possibility of cancer, having to wait for that doctor to tell you what the result is on the bit of paper in front of you. There's nothing to compare with the anxiety you go through, I think.
It was such a shock, and I had absolutely no family background, and I had DCOS like you did, and I went in and saw the nurse, and she said, oh, you have to have a complete mastectomy. I was like, huh?
When people get into treatment, they can feel more that they've got a sense of control back in a way, something's being done about it. But then people come to the end of their main treatments, and that can be a very tricky time for people, because they expect to start to feel better and to feel relieved that they've got through the treatments, but can often feel very down, increasingly more anxious, can be more fearful again, and may feel suddenly they've been kind of dropped by the medical people. So that's a very key time for emotional support too there, I think.
I didn't have any weight. I was told there and then. And in fact, I went on my own. I was feeling so well. For 3 days, I think I cried. How do I tell my mum that I've got this? My mum, you know. Because somehow it was something we didn't talk about within the family. And when I told her, she said, don't be so stupid. Yes. I said, no, it really is true.
One area of difficulty around for everybody, I think, how do other people respond? You know, you've touched on the who do I tell and how do I tell them, but how do people respond to, and the sense you can have of needing to kind of caretake other people really and have to manage other people's responses to you. I guess one of the things I would say is you're not responsible for other people's feelings, you know, that other people need to manage themselves in some kind of way. And allow yourselves to choose who you tell too, because other people may have an idea of what you ought to be doing and who you ought to tell, but I think you have to follow your own path.
Because I remember coming home and thinking, oh my God, do I have to phone all my friends and family and tell them, make maybe 1 or 2 phone calls, and then after that you're just totally exhausted from telling people and explaining. And like you said, it's like you go from being completely well and maybe bump into someone in the street and they say, oh, you're looking really well. And you just think, oh, if only you knew.
Sometimes it can be helpful to identify a friend or somebody in the family who can be the main point of contact about their welfare that other people can refer to. And that saves them always having to be the one to do that. It may be contacting people through email is a useful thing to do. And also just to let people know, your friends know, that you may not contact them as much as you ordinarily would, but that's just how it is for the moment, and you can't always come out and do things in the way that you would either. And to be patient with that, so.
Well, I was a head teacher, and I was going to have some time off, not a great deal, but either you're not going to tell anyone, in which case the question is, where is she? Yes. Or you're going to tell everyone and you're going to say, well, it's a 50-50 situation. Yes. If I come through, it's very encouraging because it shows things are working. And if it isn't, you're not going to be dreadfully surprised and upset that you didn't know there was something wrong. But managing time, if you're a working woman with breast cancer, is quite difficult because of the tiredness and the radiotherapy and the treatment. And I think for many women, that's one of the biggest multitasking issues of how you deal with breast cancer. Not just family and friends, but your working situation, and how important it is for you, for your own self-image, if you need to go on working through treatment. And I don't know how people have coped with that.
I only had to have radiotherapy, but I was it wasn't really so physical, but I found that my concentration was very bad, and I felt very tired. So I really couldn't work more than about 3 hours a day. And a kind of miracle happened, because I'm a picture restorer, and I'd been to see probably the best picture I shall ever work on about 6 months before. And I hadn't heard anything from the owner, and he suddenly rang up just when I'd had been diagnosed, and I said, I'm terribly sorry, I can't do this. And he said, it doesn't matter, I'll wait. And that was a tremendous carrot for me to get up and get going. I realised how important my working life was to me, and how much I relied on it. And what a shape it gave to my life. Yes. And I don't think I'd really quite understood that before.
No. It's interesting, isn't it? Because for some people, the most important thing is that actually they give up work. They stop working. And they allow themselves the space and the time to learn to be and be with themselves and find themselves in another way. And that actually moving out of work and letting work go can be the most difficult thing, but actually the most rewarding thing. I was wondering what it was like for each of you when you were going through cancer and going through treatment, and whether that in any way changed your role within the family, and then what that was like for you.
As you could tell as a head teacher, extremely bossy. And I then couldn't use my arm and had to become not exactly subservient, but much more docile. And that was quite hard. I felt, I don't know what, I felt extremely vulnerable. Yes. And that was hard for me, that's all I can say.
Yeah, exactly. I felt very vulnerable too. I felt exactly the same. I actually felt like I wanted to allow people to care for me, and I actually made myself do that because I knew how I'd react if it was, say, a friend of mine. Yes. And I thought, actually, you know what, I've got to accept the help, and I have to look after myself and kind of, take it easy. And actually, I am going to take people's kind of love and attention now because I've done it for other people, and it's my turn now. And I kind of felt that actually, so I made myself do that.
When things are done by one's dear husband and roll badly, and you just have to bite your tongue.
How do you sit back?
How do you sit back and not say cruel things and not mind? And sometimes one doesn't manage that at all.
But normal life must go on.
It has to go on, yes.
yes, you do feel vulnerable, but I was quite happy for my husband to take over and my daughter. It didn't worry me. Things weren't being done how I would like them done, but it doesn't, you know, just forget it, get well, and we go from there.
I experience a lot of women who have a difficulty with being cared for and letting go of caring for others, really, and doing for others. And that can be really quite tricky for them to allow themselves into other people doing things for them, and to be able to ask other people for what they need is quite a journey of learning.
And I started the chemotherapy on the Monday with the view that probably within a few weeks I'd probably start to lose my hair. And so it started on Monday, and by the Thursday I was completely bald. Well, I said I was completely bald, it was big bald patches, and it was my choice. I said to my husband, just shave it off, because to me, mentally, and I can only speak for myself personally as well, I was able to cope with it completely bald, and then this is me, I've just got to deal with it.
I've experienced over the years that the loss of body hair is a really big one, and usually much more significant than loss of a breast, actually. Not always. For some people, the loss of a breast is the really big thing for them. It seems when a kind of last straw when the eyebrows and the eyelashes go, and of course the pubic hair may go too. So to be kind of stripped naked, you know, in these kind of circumstances is such a difficult thing for women to experience, and not looking like themselves, not feeling like themselves. So that's a difficult time for people to adjust to, and it takes time, actually. As much as anything, these things take time, and people find a way. Humour is a good way, you know, that people also find to help themselves, I think.
I had this wig on, and I'd forgotten that I had the wig on, and it was so itchy, and I lifted it up and I started scratching, and my 10-year-old son at the time was just so embarrassed, but we then started to make light of it, you know, it was like, Mum, please, no.
Helping people towards finding the right kind of wigs for them, if they're going to use wigs, or if they're going to use scarves or hats, or the ways that they want to go about it, and can be an important thing to do. And to find help with makeup so that they can still do themselves up and actually look as if they've got eyebrows, can make a great difference to people. I do encourage people to dress in their best clothes as well, you know, as far as they're able, you know, to make themselves feel as good as they can.
My husband's always saying, you look wonderful, you're fine, you're healthy. Yes. How do you know? Yes. You don't know.
There's no doubt about it that positive thinking is a very important thing to be able to do. And I think for the people who always kind of come sunny side up with things and are able to get round to a positive implication of things, it's a very useful thing for people in life, and useful to learn if they're not so good at it. But I think when people get cancer, everybody around them, through their own fear, is often demanding them to be positive at all times. And nobody can be positive at all times. You know, you're going through horrendous things, and those horrendous things need some expression, and you can't make that positive at that time. And some people need a space where they can actually tell it like it is. Not all the time, but some of the time. So it's journeying through all those feelings up to a place which is a more upside, which is the thing, rather than having to be positive all the time.
The time before the checkup, which I've had a few, is always a very nerve-wracking time.
Yes. And that would be a usual experience.
My tumour, you know, you could never have found it in a million years. In fact, they didn't even look at the mammogram for a few weeks, and then they said, oh, there's something tucked away there. And just waiting for that result is fairly scary.
Fear of cancer returning is something that everybody experiences. And at times that can be really intense. And one of the intense periods is in that diagnosis type period, really, where there's an intense fear about cancer. And as they go through, there increasingly is fears about it returning. And people, in a way, have to find a way to live with that.
Great truth is that we are all going to die, whether of cancer or not.
Absolutely.
And I find that quite helpful, actually. And the fact that one has had cancer, that it may come back. one is going to die of something.
I guess one of the things that cancer does, it makes you think about death and dying, even if it's the last thing that's likely to happen, in fact, for you. And you might not have thought about it before, and you can't not engage with the ideas about death and dying and what that means for you.
Well, I've got a 5-month-old, and I am absolutely petrified about the thought that, you know, I might not see her growing up to be, I don't know, even, well, I mean, it would be great if I could see her to 40, but, you know, I think, oh my God, what if she's 5 and something happens, or I just can't bear the thought of it. For myself as well, but I mean for her, and also have I maybe passed something on to her that means that she's got this ticking time bomb, which I can't feel guilty about exactly because it's not my fault, but I worry about that as well.
People can feel overtaken by a sense of fear inside themselves. So we might give the fear a name and talk in terms of fear coming to visit. And of course, if something comes to visit, it can also go away. And how can they make friends with the fear? What might the fear be saying to them? Is it trying to say to them, look, you know, maybe you're just overdoing it a little bit, you know, do you want to slow down a bit, or are you taking enough care of yourself at the moment? So we'd have a conversation about what the fear might, how useful the fear might be. So in these kind of ways, people can get a different relationship with their fear, and in that way begin to lessen the impact of it.
The percentage of people who are surviving is much higher. It's a scary thing, from diagnosis through treatment, through survival. It's a scary thing. But again, I think we're lucky because we're living in a century where people talk about it in an open way. It's not something you have to hide. And I think that helps tremendously.
Well, folks, we're drawing to the end of our time for this evening. It's been wonderful to have you all here and listen to your stories and the things you've had to say this evening. I do thank you for that. It's been a real pleasure.